Hello everyone, I am Nonito Serrano from BSN LMG, and today I will perform an oral administration of medication with our demonstration. Oral administration is the most common, less expensive, and most convenient route of the administration for patients. In doing so, it is essential to remember and adhere to the 10 points of medication administration to avoid errors and ensure client safety and well-being. The 10 rights of medication administration include the right patient, right medication, right dosage, right time, right food, right client education, right documentation, right to refuse, right assessment, and right evaluation. Before conducting the procedure, the first thing to do is to check the physician order to know what medication shall be given the assigned patient. So, knows the reason why the client is receiving the medication. So, the patient needs to take vitamin C for round healing. It is needed for many functions in the body, including helping the body use carbohydrates, fats, and protein. Vitamin C also strengthens blood vessels walls. So, check the medication administration record. So, with the physician order, check for the drug name, dosage. You can see both of administration and expiration date for administering the medication. So, verifies the client ability to take medication orally. Determine whether the client can swallow, is PU is necessitated, or vomiting has gastric function, or has diminished or absent bowel sounds. Perform hand hygiene to deter the spread of microorganisms. And now organize the supplies and bring the requisites to the preparation area. The requisites include a medicine tray and medicine cup, and if needed, stethoscope and sphygmomanometer. And we have here. And now prepare medication for one patient at a time. Obtain the correct drug. Compare of medication on label with MR or medication taken and exit us after removing drugs. And check or calculate drug dose as necessary, and double check calculation, check expiration date on all medication, and return updated medication to pharmacy. If there are any check record for medication, count and compare current count with supply available, especially if referring controlled substances. So, and check the medicine label with the MR, and also note for the expiration date. Place this package unit those capsules or tablets directly into the mixing cup. Do not remove the medication from the package until at the bedside. If using a stock container, pour the required number into the bottle cup and then transfer the medication to the disposable cup without touching the tablets. So fix only score tablets if necessary to obtain the correct dosage. Use a cupping or splitting device if needed. If the client has difficulty swallowing, check the medication can be crushed. If it is acceptable, crush the tablets to a fine powder with a pill crusher. Places the prepared medication and MER together on the medication cart. You check the label on the container before returning the bottle, box, or envelope to its storage place. Avoid leaving prepared medication unattended. And locks the medication cart before entering the client room.
Donna.
Check the room number against the MR if agency policy does not allow the MR to be removed from the medication cart. Now, place the prepared medication and MR on the same cart and check the room number against the MR before entering the client room. Good day, sir. I am Nonito Serrano. I am student for today. And for the verification, you are
Irregularity.
alright. So how about your birthday?
October 21, 2000.
So educates the client and the client family of the medication to be taken. That is purpose of administration, intended effect, and possible side effects. Discuss the purpose of the medication. Okay? Okay, sir. So Dr. Melendez has prescribed you with vitamin C. Its generic name is ascorbic acid to be taken 3 times a day. After meals, and it is in tablet form, which means you are taking it only. Okay, so vitamin C, it is necessary for wound healing. It is needed for many functions in the body, including helping the body use carbohydrates, such as fats, and proteins. Vitamin C also is when blood vessels swells too much, it can cause side effects such as nausea, vomiting, headache, insomnia, and more. Okay, sir? Assist the client a sitting position, or if not possible, for a side-lying position. Okay, sir. Okay, sir. You're sitting now. Are you okay with taking your medicine in that position?
Yes.
So this time I need to check your pulse. At this time, I need to check your respiratory. Sir, thank you. So sir, we will take your vitamin C. So right now, sir, since you are done eating your breakfast, sir. 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 Sir, this time the sir, thank you. Administer the medication at the correct time. Takes the medication to client within the guidelines of the agency. If the client is unable to hold the pill cup, use the pill cup to introduce the medication into the client mouth and give only the tablet or capsule at a time. If an older child or adult has difficulty swallowing, ask the client to place the medication on the back of the tongue before taking the water. Give the client sufficient water or prepared juice to swallow the medication. If the medication has an objective involved, please ask the client to suck a few ice chips beforehand or give the medication with juice. Apple juice or pudding if there are no contraindication. If the client says that the medication you are about to give different from what the client has been receiving, do not give the medication without first checking the original order. So, stay with the client until all medication have been swallowed. Okay, sir? You are very good now that we have done taking your medication, and now I am going to leave you here, and so that you can rest now. Okay, so do you need anything? Anything?
Yes.
Okay, sir. I come back after a few minutes to check on you. Thank you, sir, for your cooperation. Alright? And documents each medication given. Now that I'm done with administering the medication to my patient, I will proceed to the documentation process of the procedure I have just done. And records of medication given, dosage, time, and complaints or assessment of the client and your signature. So the documentation will include the medication type and type it was given. So I have given my patient vitamin C as per the doctor's order. The vitamins is generic name to ascorbic acid to be taken 3 times a day after meals. If medication was refused or commented, record this back on the appropriate record. Document the reason when possible and the nurse's action according to agency policy. Now also include in the documentation any complaint from the patient is the documentation of if the medication has been refused or omitted, then also document the reason for omission. Lastly, always remember to affix your signature on the documentation sheet indicating that you are carrying out of the doctor order and dispose of all supplies appropriately and replenish stock and return the card to the appropriate place and discard used disposable supplies.